Good morning, everyone. Nesta and I had the pleasure to facilitate the maternal and newborn group. And first of all, I have to commend the group. It was a very, very engaged and sharing group, in the sense that despite the very challenge room being a cinema setting, the groups worked together on the definition and then shared a lot about the partnerships. So huge thanks to the groups working very intensively with a very good sense of atmosphere. Thank you.
So I facilitated the Global Mental Health Group together with Eric, and we were about 40 to 50 people also in the cinema hall, and we started with a very active engagement. We used our stairs, and the people had to arrange on the stairs. And I think it was a very good way to get to know each other, and we had a lot of fun doing this. And then we did some very brief pitching of the projects, and afterwards the groups, we created groups, and they worked on the challenges and solutions they had during their partnerships. And in the end, we had some input on triangular cooperations, which was great, very informative, by a dear GIZ colleague, and we will see how we will use this knowledge today.
Yeah, thank you. So I facilitated the group on advancing surgery. We have got the tent as the venue, so it was the bath between heat and cold, because the heat came in very strongly with a lot of wind, and we had to switch it off sometimes, and then it became cold, and the other way around. But it was a nice atmosphere. I think everybody felt well, so we did a kind of group analysis, constellation of the group, different professions, and expectations we asked again, more in detail than in the morning, and we heard a lot of success stories from different partnerships, and I think I had the feeling that all participants were really engaged and loved to exchange, to discuss.
Good morning, everyone. I had the honor to moderate the group on fragile environments. It was a really interesting day yesterday. A lot of curiosity in the audience, and a lot of sharing of experiences. We started actually with setting a bit the common ground of what fragility means, because that can be very different things for the different countries that we are all working in. And then we moved, we actually did a walk, or the people walked around in pairs, and then we came back and discussed challenges and opportunities, or actually challenges and proposed solutions or ideas of how you deal with these challenges in fragile environments.
So I had the honor to facilitate the group of anesthesia and emergency medicine. We had a similar approach, I think, with a very energetic group. I told them, please get in contact with each other. I didn't need to say that because it would all happen by itself. We went for walks in groups of 4 to look at Kosmos, and also did some things outside to get to know the group a little better, and then we collected in small groups challenges, and we had a nice discussion of how they're connected, how we look at them from different perspectives, and today we want to find out what to do with them exactly in terms of recommendations, opportunities, and outlook. I'm very much looking forward to that.
Yeah, good morning. I had the honor to chair the Advancing Care workshop, and we are a fairly small group, 30 people, but we had a very focused workshop, and it was very interesting to see, after shuffling the group in 5 different smaller groups, how to identify different topics that are very relevant for the field in cancer care. And we had so many good ideas developed, and we will work further today on this to also then develop some ideas for further projects and networking. I'm looking very much forward to see you back in the workshop.
Yeah, hello, good morning. My name is Timothy, and I was part of the group on pandemic prevention, emerging and re-emerging infections, zoonotic, neglected, and tropical diseases. Now, if anyone knows that by heart without reading off the screen, then let me know. We had...
Your time is done, just reading the...
We had 48 participants. We were expecting or fearing 80, so that's why we got a big group of facilitators, namely Eva, Lea, Han, myself, and then also an intern called Aras. And we had participants from all over the place, from Tanzania, Togo, Cameroon, Madagascar, Gabon, Rwanda, Malawi, Cote d'Ivoire, Bangladesh, and many others. And so we split into 4 groups, all stayed in our venue, which is a cinema. So very challenging. Other problems than the tent group had. But actually I enjoyed it so much that in the evening I decided, when this was all over, to go to the cinema again and watch a movie. We spoke about shared successes and challenges, and just to name 2 examples of a success, when COVID-19 started, travel funds became free, and these were used for other ends, so they didn't go to waste. That was a success for many groups and participants, and the challenge is that the appliances and machines in hospitals are not standardized, so when something breaks, you can't get a spare part from a different hospital near you, but you have to sometimes get an entire new machine, and there was a great wish for standardization of these technologies.
Wonderful. Thank you all